All righty. It takes people like a second to start watching, but for those of you who are like, wait a minute, this is your second time this week. It is. So we typically are once a week. But we had a client. Basically, we're booked up. I'm having my baby and not my baby. Well, it's my baby, but like my wife is having a child in like 3 or 4 weeks. So we're pretty much booked up until then. So for folks, we've had kind of a slew of folks that want to come on the show. So we've maybe Dan, maybe it's a twice a week show now. Who knows? Who knows? But you're on mute. You're on mute. This is your first time. This is your first time on the show, though.
Yeah. Welcome to me for the first time being on the show. I like once a week, Taylor. I
Okay.
like once a week.
All right. Sounds good. So Dan likes me, but only likes me in small doses. Got it. All right.
Correct.
So
Yep.
Before we dive in today, excited for this, but want to give you a quick background on what Unicorn Finders is, what we do, in case if you're watching this for the first time or the 16th time. Basically, Dan and I have been at this thing for 4 years now. We started this. We were telling Brian backstage, we started this during COVID, where, as dudes, you need an excuse to hang out. So me, Dan, and Jake, who was with us, he has just gotten so busy. He's still alive. I said
still
one
alive.
day.
Yeah.
I said one day he's not with us anymore. He is still with us. Yeah. So Dan and I are still going at this thing. And basically, we like to uncover companies doing really cool stuff that you haven't heard of yet. Right. And that's kind of our goal. We're really excited to talk to Brian this morning. We had a great conversation with Deo on Tuesday. They're basically starting to pay people to get off social media. So really cool company, what they're doing. So we're going to do a complete 180. And we're in the healthcare space today on this Thursday. So enough of me yapping. Brian, let's give the people what they want, man. Who are you? What do you do? Or what does the company you're at do? Because you do a lot of things. So let's start there.
Yeah, thanks. That allows me to kind of explain this and bring it down. Yeah, Taylor and Dan, thanks so much for having me on here. Really appreciate your time. It's great to be here. I'm CEO and co-founder of a company we call Dart Health. And you can actually find us at the domain name dart.health, because if you're in the industry, you get the .health extension. I know, it's great. So there's for people that live this every day, this is something that you probably can't believe there's a company that exists that does this, because it's a big problem for the industry. But if you're in the health and benefits space, I'll kind of draw a wider map and I'll explain what that is. Large employers, Walmart, Tyson, Intel, the biggest ones out there, they actually cover 65% of Americans' health and benefits. So what that means is they're
complete coverage.
Yeah. So that's medical, that's benefits in addition to going to the doctor because you're sick. So those large companies, they're competing for employees from this employment pool of Americans, highly talented. And so they're trying to lure you from other companies to say, hey, come over to Google. Not only do we give you naps, we also, one of the hottest things in the space, right? We all want the nap.
Could use one, yeah.
Right. Well, okay. So if you're well slept, maybe like Taylor, you decide to, I don't know, have a baby. Well, there's this, a lot of people actually struggle with that. They for whatever reason, they may have to go visit a fertility clinic. So fertility benefits, this is, again, in addition to just going to the hospital because you're sick, fertility benefits, gym memberships, all the extra stuff that are benefits that can be a part of your employment, those large employers pay directly for those. What's kind of gross in the industry, and this is where it gets down to what we do, is that data relationship between the employer and then the benefits. That can take about 6 months to establish. So what we do is we have a software appliance that takes that and shortens it to about 3 weeks. And that's the best way to say it. So if you're a benefits provider, we take the onboarding process of handling eligibility data from large employers, and we make it a seamless process where we just show up and handle it for you with the SaaS appliance.
Can you give me an example of like data? Like, because I'm curious, right? So it's all right, let's say we do. So let's say we're Blue Cross Blue Shield, right?
Getting nerdy.
Blue Cross Blue Shield. That's who we use at Gun.io. So let's just use an example. So Gun.io, they seek out Blue Cross Blue Shield. They want to use Blue Cross Blue Shield for benefits. Like hypothetically, how would we use y'all?
So this would be a relationship between Blue Cross, and then if Blue Cross had another benefit along with it, or maybe in order to get Blue Cross, you have Gusto, or
We have Gusto.
Gustoworks. Yeah.
We have
Okay.
Gusto.
Great. Shout out to Denver. Gusto's right here. So
Gusto's great piece of
yeah,
software. Fantastic
same for
software.
us. We use Gusto too. So Gusto is handling that data relationship. They're saying that Taylor is this person who's dependent on Taylor or Taylor's kids, maybe Taylor's spouse.
Just like everything I fill out when I get hired, right? All
exactly.
That stuff. Yeah.
Right.
Okay.
Imagine only having to fill that out once. This is the future that we all
ever.
Like,
so say I go to another
when
job.
You get hired. Yeah, whenever you get whenever you get hired for a new job. Yeah. So whenever you're filling it out for your employer, the employer should have records of all this stuff. This is where, God, as Americans, we're like, why do I have to fill this out again? Why does the doctor walk into the office and ask me, hey, what brings you here today? Don't you guys know?
Right.
So these are the kinds of things that our company is going to solve eventually. Today, this starts with, I filled it out for my employer. So the employer actually has all these records that says, here's Taylor, here's my spouse, here are my kids, and they're all dependent on me, and that's their link to get healthcare. So whenever that employer goes out and talks to Blue Cross Blue Shield, that's the relationship right there. Is in this case, it's Gusto, because Gusto is probably the larger entity. But Gusto could use Dart Health to just say, here is whenever we connect to Blue Cross Blue Shield, this is what we use. And then Blue Cross Blue Shield says, great, we'll pull it from the data nexus. And then all your eligibility information. And here's where it gets really cool, is Taylor has agreed to sign up for text messages. So he signed our consent form. Taylor has agreed to sign up for, here's a really cool thing we're working on, is imagine being able to go into Gusto and you have a toggle where you could just drop it down and say, I want Blue Cross Blue Shield this month. And then 6 months down the line, it's not working out for you. So you know what? I'm gonna go to Guardian, or I'm gonna go to some other option. I guess maybe not Blue Cross, but this does work with hospital networks where you could pick a Mercy Hospitals, or you could pick a someone who wouldn't otherwise get your business, because I guess Blue Cross is the big entity. The smaller entity is whoever the hospital provider is, and being able to say, I just want to switch there. And then a hospital provider, they can now send you something as simple as a text message to say, yeah, we're open on Tuesday. Come on in.
All right, I just had an epiphany.
No,
Dan, do you remember Vet Verify? Were you on the line with me? So Vet Verify, I believe, was doing something like this for veterinarian vets and kennels. So basically, every time you have to go to a new vet or go to a new kennel, you have to call the other kennel or the other vet. Can you fax the paperwork over? And then what Vet Verify does is they've basically developed a software to where now if you go to a kennel, they can just literally go to Vet Verify and get all that information without having a bunch of back and forth. Is that kind of close with what I'm kind of describing?
Yeah, that's really close. That's called a clearinghouse, where Vet Verify would have all that information for everyone. We are actually holding it just for the employer. So there's a much more intimate relationship. So that employer is handling probably extra details. Okay. Like the text.
So if I were to leave Gun and go to, let's just say, Vaco. Okay. I'm gonna go work with Dan.
Probably not.
Probably not. Does Vaco have to use y'all too for me to be able for that data to seamlessly transfer or that information?
I think your data sits with the employer, right?
It sits with the employer. So
right, but
so
they
it's kind of like a
Dart?
greenhouse, and it would be like setting up like Workday, Taylor. You know, like when people complain about applying for jobs, like it sits with the employer. I think that this sits with the employer as well. But I think if I understand this right, is if Gun.io or Gun.io wanted to add additional benefits later, the process of adding those would be significantly more streamlined using Dart Health to ramp up you onto additional networks, or giving you the access to additional networks or benefit choices for yourself.
This is actually where we're drawing the line, and you're absolutely right to say in the connection of companies and where the data relationship lies. We're drawing the line, and Dart would sit in the middle and make all that faster. The hard part is for us is we're actually, our customer is the benefits provider. The Well Hub, Carrot Fertility, Kind Body, so the benefits provider themselves are that network of benefits providers, and Sonicare, Collective Health, Newtopia. Those benefits providers are our customers. And so what we're doing is we're speeding their ability to access the employer. What we would, so from the employee's perspective, oh man, we just onboarded benefits in a couple of months, or in maybe even a month. That was neat, but there's not really something that the employee can do. It's the employees of those benefits providers. If they're listening right now, they're going, no, that's crap. You can't do that. That's too fast. We do.
The goal would be for your large companies to be able to increase their marketplace of options, and you decrease the amount of time it would take for a new benefit provider to be open and I know you guys are the marketplace, but into the marketplace of benefits for a Tyson, a Walmart, a NVIDIA, Intel, whatever it might be.
Yeah. Eventually, we would love it if we became a standard, because this is the thing. We're talking about this pre-show. You would think by now, because we've been working on this for over 20 years, and by that I mean our team has been working on this for over 20 years. You would think there would be a standard. The sick part is there is a standard and nobody uses it. Because every large employer, they not only have the standard set of data, they also have their superset of data that says, well, this is what it takes to service our employees. It's not just this big; it's this much bigger. So the standard has not been followed ever since the day it was started. Even the day it was started, the companies that signed up and said, "Yeah, I'll follow the standard, right? I'll create the standard." Even they were modifying it and using a different standard.
Why? I know the answer is probably it's just people involved, right? And people do things, but if there's a standard that exists, why are companies not following that particular standard? If, like, at the end of the day, it would make the process more streamlined and save them money.
Probably the simplest way to put it is phone numbers. You've got a phone number. If now we're used to a 10-digit phone number,
right?
In the US, right. If you're or 11, you have the +1. So 20 years ago, it was 3 numbers plus 4 numbers, and that's all you would dial. You'd pick up you would walk over to a phone and pick it up and then you would punch in. If you didn't punch in just 7 numbers, you're like, oh man, this is going to cost a lot of money, and so then you would make a phone call. A modern phone, we just know it's 11 numbers, so those original 7 weren't enough. We had to add the area code. Same thing with eligibility information.
Interesting.
Yeah, it's not only here's who's eligible; it's all the extra stuff that employer needs to package up and send along. And then you can also imagine there's companies that were established decades before this standard. They've already got their computer systems they've invested millions in. These are very large employers, like Boeing is one great example, where the old standards still exist. We're just putting a layer of Microsoft CSVs and Excel on top of it to transfer the data. But then you got newer companies like Google, and then they, whenever they decided, hey, we got to datafy all of our employees, great, let's use the modern standard. It can be up to the second on eligibility. We'll send it out the door. Why do we have to follow this old crappy stuff? Let's use JSON and all the things that our developers would love to use. Great. New standard. Now we have a totally new way of doing it. And to be honest, I don't know if Google uses JSON or what standard they're using. We haven't interfaced with them yet. But
for the record, if you put a gun to my head and asked me how many numbers there are on a telephone, I would have never known that. So thank you, Brian, for teaching me that.
Yeah,
I had
That's
no idea.
absolutely bonkers that you just admitted that.
Yeah, and it's fine. Listen, I don't go around anyways, that's not the point. Brian, how are you guys making money, man? Like, what does it look like for the business? How do you guys
great question.
How do you guys make revenue?
Well, okay, so I love that now that we're doing this, you admitted that this is a COVID thing. We needed an excuse to hang out, right?
Yeah.
So it kind of goes back to my own story of how we're making money. It goes back to just before COVID.
Oh, for real?
I was at a startup February of 2020, man. The startup didn't get another round of funding. We were trying to build something that would go up against Shopify and would be the next step if you had a Shopify store and you were at a certain, you kind of capped out based on Shopify's limitations. you would jump over to our thing. It was called Engine Commerce. Great startup, amazing team. Some of the smartest people I've ever worked with were in charge of that company and working with us there. I was VP of engineering, and the CEO and the CTO I had worked with or for something like, I think it was like 15 years we've been working together, maybe 10 years we've been working together. So really well respected and trusted team. So February, we didn't get another round of funding. That sucked. Everybody was told to go home. So there's March, COVID hits, and no one's hiring. So I hang out the shingle. I just say, hey, I'm taking clients, and then a consultancy. I've got the domain name, sagedigital.com was born. So we started finding I started finding clients, the royal we, and then after about it was a little less than a year. It was too much for me to handle. I had to hire someone, so I went back to my senior team and hey guys, where are you at? Like we had actually already had the Slack channel. We were already talking to each other. Where are you guys at? Are you enjoying your jobs? No, we want to work together. This would be great. Let's get the band back together. So I started hiring back from my senior team, either full-time or one by one. Along the road, we started landing clients that were awesome to work with. We started doing, because of our history in high performance computing for millions of e-commerce shoppers, where we're trying to find gold among everyone that lands on our website. From that history, we moved into this area of HIPAA compliant work, where we're working for clients that are dealing with the Boeings of the world and the Walmarts. So we were doing great with high performance computing stuff, and then we're learning these new standards. And I just so happened to start working with Jason Cole. He's my co-founder at Dart Health. And 2 years ago, we were at a place where this makes more sense as a SaaS, that we can build Dart Health as a SaaS, and then help the startup that we're building this along with lower their costs. It was going to go through their runway if we just charged them for it. Could lower their costs by doing it as a SaaS, and then if that company does well, then we'll do well along with them. So we're kind of in this together, right? It's always been our thought model for everything we do. We're a partner more than we're just going to charge you by the hour. So Dart Health was born, and we now our client is doing fantastic. It's Imsonicare is the name of the company. They're doing great work. They're unifying health plans for major employers, and Dart Health is there helping them as they grow. All that said, it's bootstrapped. Like there it is in a short version, but it's bootstrapped from a group of people that have worked together, not just since COVID. We've worked since before COVID, but all of this comes from kind of the necessity of building a business from fundamentals that work, rather than just taking a bunch of investment money and I guess trying real darn hard with something we don't know anything about. Instead, we built this from fundamentals that allow the business to survive on a much more stable foundation.
That makes sense.
So what's the sorry. No, go ahead, Taylor.
No, Dan, go ahead.
No, go ahead, please.
No, go ahead, Dan. You first.
So please. Well, this is awkward. What's the growth strategy for you guys? Obviously, it's going to probably be to continue to add more clients or more offerings, right? Yeah. And to continue to work on those. So what does the next few years or next 6 months to a year look like for you guys?
Yeah. Well, okay. So going back to the company fundamentals, with startups, you have to grow at all costs, right? Almost sometimes despite yourself, despite your clients.
Sure. Yeah.
What we're doing is we know this is a money and cost saver. I think we. No, I don't know that this stat came out on the air. IT is the fastest growing cost in healthcare. People think it's prescription drugs because that's one of the largest costs. And prescription drugs, I think they're growing at 17% compound annual growth rate, which is insane. Imagine 25% compound annual growth rate. That's the cost of IT. That's how fast our decisions in healthcare are making us spend more money on the problem year over year over year. So that's what our product addresses. We're a strategic piece to lowering the cost of IT between you, the benefits provider, and the large employer that you're servicing. So first of all, stick that in your calculator, or text me. So we don't have to grow at all costs. We're doing fine as a consultancy. We're doing fine as a business that is serving our customers with exactly what we've built so far. Because we built exactly what was needed to launch. We didn't build something and then suspect there was a market based on research. We did it to solve a real need that existed right there. And we've been benefiting, our clients have been benefiting from this for 2 years or a year and a half of production. So growth strategy is to find another company, find another benefits provider who is ready to reap that same benefit and partner with us really to help us improve the product for their use case. If we could do that one at a time for some of the bigger companies like Sonicare, again, Newtopia, Collective Health, Progeny, if we could kind of sidle up to those, or if we, Dan, you mentioned earlier, CoreStream or Virgin Pulse, some company like that is their business is, whether they knew it or not, getting into data from employers, and that's the gross stuff they have to solve in order to really work on the problem they want to solve, which is better dissemination of benefits. To get back to their innovation that they're bringing to the market, we want to handle that. So just going up and finding them as a client or connecting with them as a client is what we really want to do. And then we're going to grow as steady and predictably as we need to grow. We honestly don't want funding yet. If there's strategic funding or some sort of strategic partnership that works, we would take that.
What do you so back to, I love it. So back to revenue. Do companies or the benefit providers pay you guys a monthly? Right?
So it's an annual agreement, and and it's an enterprise contract. So usually they like to pay upfront for the term. But enterprise contracts are you start off on 1 foot, and then once all the teams have had their go at it, it ends up being what it is.
Awesome.
But the simple answer is it's an annual SaaS license.
Sure. Okay. Cool. Sweet.
For the company, not for the provider, correct?
Oh, for the benefits provider. That's
for the benefits provider.
And the way they can look at this is this is a problem that is usually 3 to 5 people taking 6 months. What we do is we know that we can reduce that to 1.5 people in 3 weeks. So there's the cost benefit analysis, is you can significantly slash the amount of human capital that you're putting into this, and then the operating costs should be much less than what you were operating at before.
So as we wrap up here, I wanted, because we're already almost at time, which is crazy. Talk about what we talked about backstage about phone numbers. Not that I didn't know there was 10 digits in a phone number, but more along the lines of why this system has been so broken for so long.
Oh man, it's you know what? It's not because of any kind of bad actor. It's because we as humans are problem solvers. That's just what we do. We come into something and we see how it works, and we go, that could work better. Sometimes that there's a little bit of a Dunning-Kruger effect where you don't know what you don't know until you get into it. You're just trying your best. So whenever you come to solve a data relationship problem, maybe you didn't know there was a standard because it just wasn't well broadcast, or you didn't know what tools were available on the market to be able to solve this. You're trying to do more with the less that you've been given. And because we have so many people working on this problem at the same time, we don't have the same way of solving it twice. So that's what we're trying to do, is offer a strategic, it's already solved. You can come in and it's already solved because it's standardized in the middle. This is kind of the brilliance of my co-founder. Standardized in the middle so that you only have to hook it up to your downstream reporting, analytics, anything that runs your back office for the benefits provider. Hook it up once. And then whenever you go to talk to a new employer, that's our job. We get in there and we handle their data source. and we hook that up once. But we handle that in lightning fast. That's one of the reasons we call ourselves Dart, is we're fast to hook up these new data relationships in just a couple of weeks.
There you go. That's awesome.
I love it.
Man, there's a whole area I had no knowledge about, and now I have a lot.
I'll be honest with you, Brian. We bring on a lot of different types of companies, and sometimes you're like, I totally get it. Know that there's an issue. There's sometimes you bring people on like yourself. You're like, wow. Unless you're in the space and you know what those costs are, and you kind of see how the sausage is made, if you will. It's fascinating to learn, right? And that's what I think is so cool about this podcast, is that we get to talk to so many different people that are solving problems, whether they're in front of your face or not, but impact you drastically in overall benefit costs, in terms of overall just cost of healthcare in America. It's fascinating, and I really hope that you guys continue to go on the rise that you guys are going on, and continue to impact the employee who I know is, looking for some savings, hopefully being passed down by the company. And that's a utopia world, but
Yeah, right. Well, I appreciate that. Yeah, that's great.
Yeah,
I'm happy to spread this knowledge. This is not something that I was even.
No, it's crazy. I mean, I was like
a handful of years ago.
No, this is cool. I'm 1% smarter now. Well, Brian, thank you again for coming on, man. Stay on real quick so we can say bye to you backstage. But for those of you tuned in, thank you so much. I see the ticker up at the top left. Had quite a few people tune in, so thank you so much. We appreciate you all, and we'll see y'all. We're off next week. Dan's doing some training. I'm actually emceeing, hosting Render ATL. So we'll be off next week, but we'll be back the following week with my dear friend David Head and Endorsed AI. He's building a AI platform that helps basically match resumes to recruiters and hiring managers faster. So it's a really cool product. Wow. So anyways, y'all have a good one. Brian, thank you, my friend. Appreciate it. Y'all go check out Dart Health. Peace.